We're going to come over to a wall for a postural stretch before we begin our cardio slider series. I'd like you to face the wall, dorsiflex your dominant foot, bringing it onto the wall at the bottom, dorsiflexing the foot, and you're in kind of a staggered stance. Your back leg is just a few feet behind the front foot, and you're still hip distance with the legs. Now, I'd like you to hold onto the wall with both hands at chest height, keeping your focus of your eyes up. Inhale, prepare, and on your exhale, bend your knee of the foot that's against the wall. And then on the inhale, you can release back up, feeling your pelvis pull towards the floor. And just make sure that the foot is up the wall. So you're stretching out, you're getting a lot of dorsiflexion in the foot to combat that plantar flexion in the ankles. And every inhale, you're grounding yourself by pulling your pelvis towards the floor, lengthening your side body. Every exhale, you're bending that knee, deepening into that deep soleus stretch. You're getting that foot a little more agile and mobile so it can grab those sliders and work efficiently. And you're also opening up the calf. Let's go ahead and switch sides, setting up on the non-dominant side. Watch out for leaning forward with your torso. Think about retracting your shoulder blades, so pull them together. Lift your chin up. There should be space between the chin and the chest. Focus of the eyes is about a little higher than eye level. And the pelvis is driving forward, but at the same time, it's as if I have your pelvis and I'm pulling it down to the floor. So you're getting length through the QL, through the external obliques, and the abs are pulling in opposition. They're lifting in and up like a tornado all the way out through the crown of the head, up through the sternum and all the way out. So breathe into that. We've got 2 more breaths. Inhaling to ground, exhaling to deepen. Inhale, ground, exhale, deepen. From here, we're going to move into a nice side body and psoas release. So I'd like you to grab your lightest loop band and bring it around your wrists and take your arms overhead. You can pull out a little bit on the band, engaging your scapular stabilizers. So with the arms overhead, we're going to cross your dominant leg behind the non-dominant leg, bending both knees and making sure there's weight on both feet. Side bend in the direction of your front leg. Press the pelvis forward as you're doing this and try to slide those shoulders down the back, making sure they don't elevate. And again, if the neck is straining, take your eye focus, eye level from the lateral flexion position. Shoulders down, soften the chest, and you can come in and out of it. You can make it active, inhaling to come up, exhaling to go down, or you can hold it down in an isometric hold. From here, let's switch to the other side. I just want to release the hip flexors by having you thrust the pelvis forward and get into that psoas complex because we're going to work on strengthening them. And if you've been seated for work or travel, we don't want to injure the hip flexor complex. So hear your breath as you exhale to bend and you inhale to lift up. See if you can keep the knees soft as you're doing this and your whole torso grounded, no pelvic movement side to side. Keep that going. Give me 4 more. 4. If you're actively moving in and out of it, exhale to bend. Inhale to lift. Shoulders gliding down the back. Exhale, bend. Inhale, lift. And what's nice is we're also recruiting the external obliques. And 1 more. And let's go ahead and set. We're actually going to use this. We're going to take the second to lightest loop band, and we're going to need that second to lightest loop band for our upper body for the first exercise. So I'm going to walk you through at a slow tempo. Give me 50% effort of the 3 exercises we'll be doing. Our feet are going to be on the slider discs, so you can use discs that look like this, or you can use washcloths if you're on hardwood surface. And I advise using toe socks for a better grip as well. So we're going to bring this second to lightest loop band above our elbows, and we're going to take our upper arms as high as our shoulders, pulling out, keeping the collarbone wide, and keep your arms in the frame of your body, meaning don't go outside of your shoulders. Just go about this far and watch out for drooping elbows because then we're going to slip into that kyphosis. So we're going to find what I call a ballet squat. It can also be called a sumo squat. Flat back, toes are on the sliders. coming into second position, ballet squat. We're going to walk the sliders to our right or left, depending on your space, about 4 sets, so about the length of 2 yoga mats if you have the space. And then we're going to twist in the direction we just walked 4 times. 4, twisting our torso, 3, 2, and 1. We'll inhale to lengthen our arms up, and we'll exhale to bend back down and travel to the other side. So the direction you're traveling, that's the direction I want you to twist. So you keep that momentum going. But so you're twisting in the direction you were traveling, and you're going to watch out for pelvic movement. I want you to stay low in the sumo squat, and also watch out for your pelvis. Is it tucking under? Is there a way you can keep some extension when you're low in that sumo squat? Give me one more for practice. Sitting low, walking it out. And we're adding the standing up, stretching out those arms as the arms extend. And then back down. And if you're hitting your head with the band, then maybe you don't extend your arms fully, or maybe you keep them out in front of you a little when you extend the arms overhead. This felt nice to me, but it may not feel nice to everybody. So make it work for you. Just make sure that the movement as you travel side to side, you're engaging your lower abdominals and you're keeping your pelvis tipped back. You're keeping some lumbar extension. Okay, let's learn our second exercise. This exercise, we'll need our lightest loop band around our ankles. And we'll need a 3-pound weight in our dominant hand to start. We're going to be doing what I call scissor legs. And this is a hard exercise sometimes because you can lose the sliders. And if you find yourself losing the sliders, move into leg reaches back. That's a little easier. The arms are going to stay in an isometric hold in a cactus with the dominant arm loaded with the weight. So both arms in cactus, dominant arm has the weight. From here, I want to see you give me 8 little slider, switching your legs, little shuffles of the feet, and we're turning. We're doing a quarter turn. So if you start at 12 o'clock, you go to 3 o'clock, and you stop at 3 o'clock. And from there, we're going to bend in the opposite direction of our loaded arm into a side oblique crunch, lifting the leg of the arm that's not loaded up into side knee flexion. So we're bending the body and bringing the leg up to meet it. So the leg is out to the side. So it's like a forward knee flexion, but it's out to the side. Foot is dorsiflex. You give me 4 of those. And then with both feet back on the slider, we do our 8 shuffles to come back from where we came from. So if you're at 3 o'clock, you go back to 12 o'clock and you're holding those weights, that weight up, and you're doing that sliding motion. So we've got 8 as we shuffle. And then we have the band around our ankles. Now I'm showing you what it looks like, but I have tight hip flexors, so I'm not going to wear it, but you're going to keep this second to lightest band on as you're working. And this is going to add, when you do your lateral flexion and your side knee flexion, it's going to add work to the hip flexor to strengthen it. Okay, our next exercise we're going to be doing, and let's do 2 sets on the non-dominant side just to kind of even out. So place the weight in your non-dominant hand, and let's do the exercise and feel what the other side feels like. So 8 sliders, turning, and once you've turned, give me your cactus side bends, and your torso is bending too. Watch out for the front of the ribs. Think about your sternum melting in towards your shoulder blades, closing off the rib cage, but engaging the lower abdominals. And you're bending towards the knee that's lifting. Excellent. And then we're going to do one more, same arm, that non-dominant side. Inhale, exhale, turning. Good. Inhale, prepare. Exhale, 4 lateral flexions. Watch out for dropping your chin forward as you side bend. Keep your focus up. Abs engaged. 3, 2, and 1. From here, we're going to need that 3-pound weight. We can lose that loop band. And for this exercise, we'll be moving in the sagittal plane, traveling forward and back. We're going to hold the weight in the dominant arm just so we can learn the exercise. Then we'll try the non-dominant arm. We're going to do cross punches. And as we do it, we're doing leg reaches to the side with our feet on the sliders. So we're reaching and traveling forward whatever your space will allow, 4 to 8. And then once you get forward, hold the heads of the weight with both hands. And you're going to lift the weight overhead. You're going to lift it overhead as you slide forward into a lunge. Start with your dominant leg sliding forward. You're going to give me 4 and 3, staying on the same side because we'll switch sides when we switch the weight in the hand. 2 and 1. Bring the weight back to your dominant hand, and we're going to do the cross punches traveling back with the side leg reaches. Give me 4 or 8 of them. You're traveling back. You're lifting up through your pelvic floor, reaching, and then both hands to the weight, same side, dominant leg forward, 4 lunges. Give me 4. Using your lower abdominals. Exhale forward, inhale up. Exhale, inner thighs, pull back as you go forward in opposition just to give you even more stability. Wonderful. Let's switch sides just so we could do it on the non-dominant, use the non-dominant arm and do the non-dominant side. Give me 8 to 4 punches traveling forward, using your abs, plugging your shoulders down, keeping your focus up. 4 lunges at the top. Inhale to prepare, exhale to slide out. I want you to, as you inhale in on the lunge, to feel your pelvis pulling towards the floor. Staying deeply rooted to your lower pelvic floor, feeling the length of your obliques, traveling back for 4 to 8 repetitions, and then we've got our 4 at the bottom, those lunges. Exhaling forward because you're going down, inhaling up. Exhale, inhale. The arms are going up though, but we're focusing on the lower body with the sliders more than anything here. Okay, so we're going to begin our cardio burst. This is level 2. We're going to have 50-second recoveries. During these recoveries, feel free to grab water, take a stretch if something feels tight, but don't sit down. First exercise in the frontal plane, traveling side to side. We had that second to lightest loop band around the upper arms. We're doing our sumo squat. We lower down 4 to 8 traveling side shuffles in your sumo squat with pelvic extension, twisting in the direction you just traveled, and then lifting the arms up on the inhale to begin again and lower on the exhale. Here we go. 50 seconds on the clock. Counting you in 5, 4, 3, 2, 1. Give it all you got. Remember, form is important, and the arms are isometrically held. They're not going up and down as you're traveling side to side. They just lift up at the top on each side. The torso twists are just in the direction you traveled. You're isolating, working from the rib cage, not from the pelvis. There's a tendency, I sometimes hold my client's pelvis as they're doing this, and they notice how much they're turning their hips. We're trying to isolate the torso and recruit the TVA. So I want to see more twisting there. You're still low in your sumo squat, so the inside knee, if you're twisting to the right, the inside knee shouldn't be traveling to the right. It should be staying to the back to the left. Breathing, 5 seconds, counting you down. 4, 3, 2, 1. Take your break. Wonderful. We're going to have a 50-second break. Grab water, take a stretch. We're going to repeat this exercise. So final set in the frontal plane. Challenge yourself to get low in the legs. If you feel knee pain, check your feet out, check your ankles out, check your knee traction. Use your core. So you want your knees tracking over the second and third metatarsals. And you want to lift through your pelvic floor, and you want to watch out for the forward head syndrome because that's going to it's going to get the band in your face for one thing. Get the elbows as high as the shoulders, pulling out about as wide as your shoulders on that band. Fingers long towards the ceiling or sky. Watch the head dropping, counting you in. 5, 4, 3, 2, 1. Give me 100% effort. Get low. You're traveling. And as you're down, stay in that isometric ballet squat or sumo squat and twist from your torso. So just 4 times in one direction, standing up tall. I like to exhale. So we're doing more of like a crab walk. So it's like a side shuffle crab walk. So you're not coming up and down when you're doing the side shuffle. You're staying low the whole time. Really opening up the outer glutes, recruiting the adductors to stay low. Use your pelvic floor here. You're doing wonderful. Hang in there. Breathe through it. 30 seconds to go. You're giving 100% effort, feeling the lower abdominals under you, working hard. If you're losing the sliders, really let those metatarsals make contact, even the center of the feet, the arches of the feet. 15 seconds to go. Hear your breath, quiet your mind. Remember, cat and cow, we've done that a lot in our work together. Make sure you extend your tailbone back like you're doing your cow position, arching the low back with the abs engaged. Counting you down. 5, 4, 3, 2, 1. Take your break. As you're taking your break, I'm going to show you the second exercise we learned in our warm-up, the transverse plane exercise. We had that lightest loop band around our ankles so we can recruit our hip flexors. It looks like this. I won't be wearing it because I do not have flat back posture, but you will be wearing it. And you're going to hold your 3-pound weight starting in your dominant hand in cactus. The arms are isometrically held. The only time the arms move is when we do our lateral flexion, when we're stationary on each side. We're doing our scissor shuffles, I'll call them, because the legs are staying on the ground. 8 of them to turn, then in place, side bending. We'll do one side, so you should be doing the same side. You're bending in the direction of the arm that doesn't have the weight, just so you know. And we'll repeat that side, and then on our second set, we'll do the other side. I'm counting you in for 5, 4, 3, 2, 100% effort. Give me all you got. Both arms are up in cactus. Shoulders are plugged down the back. Core is tight. And watch out for the hiking hip. So the hips are going to want to hike here. Imagine me pulling your pelvis down as you're lifting that leg up into side knee flexion. You should be able to keep the hips even. It may decrease range of motion. That's all right. The leg that's lifting, make sure the toes are dorsiflexed. We want to combat the plantar flexion in the ankles. Those little scissor shuffles are small. You're initiating from your center. Your core is driving that motion. You're keeping your chin lifted up, collarbone wide. I like to think about energy lines in the body, and I always think about the pelvis pulling down to recruit more of my abs as the pelvic floor muscle pulls as the pelvic floor muscles pull up. You're doing great. Counting you down. 5, 4, 3, 2, 1. Take your break. Now's the time to get water. Anything that needs a stretch, take it. Use your wall or chair for a stretch. As long as you're doing it actively, don't sit down in that chair and just, we're trying to elevate that heart rate. And cardio bursting is an efficient way to do so, and it saves time, and we all are short on time, so we can use that. You've got about 10 seconds, so get set up. 50 seconds goes quickly. I'm going to count you in. Well, you actually have 5, 4, get set up, 3, 2, and 1. Here we go. Second set in the transverse plane. Give me 100% effort, as hard as you can go. Remember to hear your breath. I like to take a little mini pause before I move and inhale and ground myself. And then on my exhale, as I brace my abs and engage my inner thighs to really lengthen my body, then I move because I know I'm connected to the muscles that will help stabilize me as I move through space. It doesn't have to be that complicated though. Just breathe. You can breathe and you will move beautifully. Follow me. I'm here as your visual. You're doing great. You have 15 seconds. We have those 8 shuffles and the 4 lateral flexion. Your foot's dorsiflexed. Your hips are even, so don't overlift that leg. If you feel knee pain, make sure you're engaging your abs and your pelvis is pulling down as that leg lifts up. You're not hiking or turning the leg in or out, and the femur bone needs to be pulled down in the socket and not externally or internally rotating. Counting you down. 5, 4, 3, 2, and 1. Take your break, 50 seconds here. I'm going to remind you of our final exercise. We're going to be doing cross punches. Feet are on the sliders, and we've got the 3-pound weight in our dominant hand, and we're going to do those cross punches, and I want to see you alternating, and then when we get to the top, we're doing our forward lunges with the overhead lift of the arms. Make sure you plug the shoulders down the back, collarbone is wide. Okay, we've got 15 seconds, and the lunges. Exhale as you go out into it and inhale as you go in. Begin with your dominant leg going forward and back because we'll switch. On our second set, we'll do the non-dominant side. Weight is in your dominant hand. Counting you in. 3, 2, 1. 100% effort. Give it all you got. 8, 7, 6, 5, 4, 3, 2, 1. At the top, we've got those 4 forward lunges to recruit our hip flexors and quadriceps. 2 areas that get weak due to the overactivity of our hamstrings and glutes and calves. And this nice cross punch allows us to recruit our TVA, and that overhead lift of the arms allows some stretching for the anterior delts and the pec minor. Keep your shoulders plugged down your back. Keep your focus up. Doing wonderfully. You've got 15 seconds to go. Thank you for taking the time to work on your heart health. It's very important that we take time for ourselves so we can be available for other people. Counting you down. 5, 4, 3, 2, 1. 50-second break. And then we will be doing our final burst in the sagittal plane. Make sure you switch hands this time, working with your non-dominant hand and taking your non-dominant leg forward in those lunges. And if you're feeling any discomfort, check in with your abs, try to retract your shoulder blades, pull them together, engage the upper back extensors, keep the knees soft, don't lock out. We don't want any bow-leggedness. And make sure you're hearing yourself breathe. And you can also slow the tempo down if you're struggling and you're feeling discomfort. So listen to your body is what I'm saying. There are a million things that could be going on and only you know what they are. And you're in charge of taking care of yourself. Okay, I'm going to count you in. 5, 4, 3, 2, 1. 100% effort. Punching, cross punches. Really let those legs come in and out, working the inner thighs, working the adductors, possibly even the hip flexors. And here with these lunges, that knee should be tracking safely. If you engage your abs, use the pelvic floor, keep your torso up. There's a tendency to lean forward a little bit. Fight that. Keep your obliques engaged. You're doing great. Hang in there. 30 seconds left. Let's give it all we got, honoring the tempo our body is at today that's giving us a nice blood pumping workout without aggravating any issues we may have with our body at this time. Hear your breath, counting you down. 10, 9, keep going. 8, 7, you got this. 6, 5, 4, 3, 2, 1. Great job.